What we're going to do now is talk about proper bib placement. I know that sounds easy and juvenile, but the reality is too often I'll walk into the operatory and the bib isn't on, or it's on in a way that I can't work. Some things you need to be considerate of when you put the bib on. First of all, Angie's going to show you how to put it the right way out. You need to be sure the shiny side goes against the body. The dull side is going to be capturing all of the saliva or be able to wipe things off on the bib. Next thing, when you place the bib clips, please put them at the crease on each side. Don't put the bib clip way over here or way in the center. It really makes it uneven. Go ahead and put the bib on, Angie. Now, why is the doctor so concerned about the bib being placed correctly? This is actually a place the doctor wipes the mirror off again and again. We need a lot of room to do that. If you place the bib clear over here, that makes it pretty impossible for us to use this to wipe off our instruments. Once again, make sure it's placed much closer to the patient's neck. That way, when the doctor's got a really steamed up mirror, he can wipe it off easily. This is what we use again and again to wipe off our instruments. Proper bib placement is key. Thank you. I'd like to take a minute to cover proper head position for the patient, for the doctor to work on it. It's very difficult to work on a patient in the wrong head position. It's very difficult for you as assistants to put on rubber dams if the person is in the wrong head position. Frankly, I can break it into two categories, upper and lower. If it's an upper, then we want to make sure the head position is like this. The person's head should be tipped back as far as we can get it, as far as they're comfortable, because the more that upper jaw is tipped like this, the easier it will be for the dentist to work on that patient. The more like this, the more the dentist has to turn over and look and break their back. Well, a dentist with a bad back is no job for you. Let me put her back and show you how we put Kelly in the right position. Since I'm going to be working on the upper teeth on Kelly, I need to make sure her head position's in the right place. The way she is right now, I can't see anything as a dentist, and you can't put a rubber dam on. Quit kidding yourself. We need to move her back. And when you work on the top, move them back as far as you can go, and then you adjust the headrest so their neck is tipped back. Now, if that's too low, no problem. What we'll do now is just move them up. But notice that I can move her up and still keep the head position where I want it to go. It's the position of the head that's key. Now I can work comfortably with the mirror. It's much easier to put a rubber dam on. If you're working on the top, you're going to notice that you need to have the chin tipped back so that we can see the upper. Now, if I were to start working on the lower on Kelly, it would be very difficult for me to work on her. It's like trying to work on a wall sideways. That's impossible. I want to work on the floor. So what I'm going to do now is I'm going to tip up her head and use the headrest to do this, not the chair. The headrest is the only way to control the proper head position when the doctor's ready to work. Now it's going to be much easier for me to work in here. I can work easily looking here without straining my back to get to her. Your rubber dam goes on a lot easier if the patient is properly placed. Remember, the lower, we want the lower jaw, the teeth to be as parallel as we can get that to the floor. And then if we're going to work on the top, we want those top teeth tipped back as far as we can go, as far as this is comfortable for the patient. Great.
Okay, after every procedure, make sure these glasses are clean. Make sure they're white, there's no debris on them. Once you place the bib, make sure that you have the patient put the glasses on. Will you please wear these glasses? It's for their safety.
I'd like to stress the importance of protective eyewear for the patients. You know how important protective eyewear is for you, but the patients need it even more desperately. They are more in the line of fire of things that can cause them permanent eye damage. Think about all the things that we use. Sharp instruments, fast-moving instruments, bleach. There's a lot of things that fly around in the mouth and we're just trying to drill out an old silver filling. You've all seen how those glasses look after we're done. Imagine all that stuff in your eyes. Far too often I walk into a room and I'm partway through a filling and I notice the patient does not have protective eyewear. Why not? Why are we forgetting and waiting for the doctor to say, put on the protective eyewear? I would make sure the protective eyewear is placed before the injection is ever given. Let's start off with protective eyewear as soon as the patient is in the chair and sitting back being comfortable. I'd rather have it on too long than to forget to put it on at all. There are several different types of protective eyewear. We use this a lot. This can go right on the patient. If the patient has glasses, this can go over their glasses if you want to. If they want to take their glasses off, use this protective eyewear with their glasses off. If they have small little glasses, their glasses will not work as protective eyewear. We need something bigger. Please remember protective eyewear on every patient that's going to have any work done where there's chemicals being used, a drill, scissors, explorers. If someone's going to be having a filling or a root canal or a crown preparation, they need to have protective eyewear. Now if they're coming in just to talk about their teeth, I'm looking at their x-rays, and we're talking about money or something else, I don't expect protective eyewear. But if we're doing a dental procedure, you get that protective eyewear on before the dentist comes in. He shouldn't have to remind you.